our fund projection, we have two lines. The green line is for scenario 1, where this is the pre-COVID scenario, and the scenario 2 is the red line for the COVID scenario. You will notice that we will be running a deficit by the end of 2020, and we will be maintaining that deficit up to 2024. Our recommendations is to consider a general delay in the implementation of the Universal Healthcare Act, to disaggregate the membership segment in terms of the premium increase and implementation, because this has been an outcry of the OFW segment. Selectively prioritize implementation of projects with minimal costing, such as communication and organization, which can be done with minimum expense.
In your recommendation, sir, nakalagay po kasi ninyo doon is to postpone implementation of primary care benefit expansion and to delay the implementation of UHC. So with the realization ng nangyari po ng COVID-19 and the pandemic, hindi ba mas kailangan natin paigtingin yung implementation of primary care services, particularly yung kabuuan po natin, yung loopholes in the health system, yung kahinaan ng health system natin, as presented kanina, yung target ng DOH on the implementation, like the primary care, the service delivery network, and of course yung financing natin. Hindi ba mas kailangan na magbigay tayo ng attention doon sa primary care packages or services?
We are trying to respond to the COVID-19 threat, while at the same time, we are also in the meantime still executing the provisions of the 7875 na tuloy-tuloy pa rin ho naman. And dun ho sa universal healthcare, what we propose to do is to focus on the lighter expenditures of the primary healthcare, like the organization, accreditation, identification of the primary healthcare providers, the registration of the members, and if we have better data, maybe we can start to introduce later on the primary healthcare packages. Depends on how the COVID-19 pandemic will play out. As of this moment, we are taking a very prudent approach regarding the delivery of new packages under the universal healthcare. Dahil our collection is actually, to tell you the truth, ma'am, our collection is about 10% what it was last year. The collection from the direct contributors has dropped significantly kasi wala hong negosyo. Wala hong nagbabayad ng premium sa mga direct contributors. And yung indirect din ho, which also depend on business activity, has also suffered a downturn. So we are falling back on our reserve, which we anticipate is going to take a hit. As of this moment, we are still taking a very prudent stance as rolling out new packages, new benefits under the universal healthcare. But as I said, ma'am, as we get more data and as we see how this pandemic develops, maybe we can begin to plan to deliver packages under the primary healthcare package. Depends on how things turn out with the pandemic.
Thank you, Mr. President. I understand yung concern po natin in the income or collection ng PhilHealth. But for consideration, sir, sana tingnan natin, the more na dapat mag-focus tayo doon sa kalusugan ng ating mga mamamayan outside sa hospital na, which is the primary care, no? Which means ang magiging impact nun actually mas maliles ang expenses ninyo into hospitalization. And ngayon, with the pandemic, marami tayong mga kababayan na hindi talaga nakakakita ng doktor o hindi pumupunta ng health facilities because of the fear, no? So, mas kailangan natin, ako ang paniniwala ko bilang doktor, mas kailangan natin sa panahong ito strengthen yung primary care services.